So I'm going to go ahead and get started. My name is Christine Bitzer. I'm the Director of Seabury's Care Management Program, and I'm so happy to be with you all today. Today we're going to be talking about navigating aging. What is an aging life care manager and how can they help? But I did want everybody to know that we are being recorded. Just let in a couple more people here. So we are being recorded and we're going to hold questions until the end. And if you can put those questions as they come up, feel free to put them in the chat. And hopefully I'll address a lot of them as I go through the presentation, but then I can address questions at the end. All right, let me share my screen here. Okay, and if everybody can mute themselves. If everybody can mute themselves, that would be helpful. All right, so we're going to get started here. Again, my name is Christine Bitzer. I'm the Director of Seabury's Care Management Program. I've been with Care Management for going on about 16 years now. So it's been a while, and I've been the director for 3. We are talking about navigating aging today. What is care management and how can it help you? So with no further ado, let's go ahead and take off. First, just a little bit about Seabury Resources for Aging. We are a nonprofit located in DC. We provide services throughout the DC area, and we really have 4 pillars with our services: good housing, good community, good food, and good resources. And just to give you some kind of highlights about what our programs are. I know there were some questions about that as you signed up, but our mission is to provide personalized, affordable services for older adults to live with independence and dignity. And by doing that, to do that, we have certain programs in the district, such as Age in Place, which helps individuals who live in wards 4, 5, and 6 in the district. To be able to do some like housekeeping that perhaps they're not able to do anymore, do some yard work, things like that. We also have our Home First Residences, which is a small community of 3 group homes located in Northeast DC, which helps very low income individuals who are residents of the District of Columbia. We also have our Older Blind program located in DC that goes throughout the District of Columbia. And then, of course, Friendship Terrace is our affordable, low-income housing, independent living at Seabury at Friendship Terrace. That's located in Tenleytown, right on the Red Line Metro, where you can get to things easily and engage with not just what's happening in Tenleytown, but throughout the area. We're also the lead agency for wards 5 and 6, which provides meals, community gatherings, and support services for older adults who live in those areas. And then, of course, our nationally recognized Model Cities Senior Wellness Center, which is also in DC, Northeast, and our Out and About program, which really helps engage LGBTQ older adults, giving them a space to connect with one another. Some of the programs that go outside of the district include our congregational resources. As many of you know, we do have a history. 102 years ago in February, we were started by the Washington Diocese of the Episcopalian Church, and we've maintained that connection, as well as with the United Church of Christ. With those churches, we have our congressional resources, which helps engage older adults in their churches, helps provide services and resource information, as well as Common Threads and the Path Ahead, which really talks about the spirituality and aging. And then one of our newest programs is Seabury Connector, which provides group transportation to grocery stores, so individuals can get out there as a group, um, sightseeing trips, theater trips, things like that. But what you're all here to hear about is Seabury Care Management. And I'm happy to tell you that Seabury Care Management is celebrating its 30th year. So Monica Miklos founded the program in 1996. And our goal really, like it says here, is to help older adults maintain a high quality of life. Our care managers provide older adults and their families counsel as well as advocacy, and we're going to talk about that a little bit more. That coordination of services. And then in 2010, we added our life enrichment services. Life enrichment services are concierge companions. They're not certified nursing assistants, so they don't help with things like personal care. But the reason why we created that program was because we found that so many older adults really needed more engagement. They were feeling socially isolated. And this was a way to meet those unique needs that they had. So, why work with a care manager? Well, a lot of what I like to say is that it helps individuals age gracefully. We all talk a lot about how we want to remain independent as we get older. Um, when you think about it, though, throughout our lives, we're very much interdependent on one another. How many of you need to talk to your children or your grandchildren about how to use this smartphone that you have, or how to work on the computer? Or maybe for somebody like me, which you can't see me because I'm sitting down, but I'm very short. So how do I reach those top shelf of things? Well, I ask my husband, and maybe one day I'll ask my child, who's probably going to be a lot taller than me. So we are independent in throughout our whole entire lives. And one of the ways that we remain independent and interdependent is by planning ahead, putting you back in control of your choices. We all know that we're going to get older. We all know that we're going to age and we're not going to be able to do certain things, but we can't predict how it is that our aging is going to look, and each of us ages uniquely, and we certainly have a different idea in our head. I like to make fun of myself because, of course, when I'm an older adult, I'm going to not need a cane, not need a walker, not need a wheelchair. But I'll let you in on a secret. I already have hip problems. So I suspect that some of those things may be in my future. So it's really about planning ahead the type of life that you want to lead, including where you might want to live. It's about building that support network around yourself. This can be family and friends. So some people may choose to move closer to family, or some people may choose, hey, let's put together a group here because this is where we've spent our lives. One of the main questions we get, and again, I'm going to go into this a little bit more soon, but who are the aging service providers in your area? What services are out there? Who are the doctors that I should be seeing? What's a geriatrician? There are plenty in the DMV. We are blessed to be able to have so many different supportive partners, so many aging services providers. But many of those things you have to pay for, and many of them are not covered through insurance. So it's also knowing, what are your paid options? What are your unpaid options? What are the things that what are the benefits that are available to you from the city or the county that you live in, and through the government. Honoring what's most important to you, whether it's family and community, whether it's your health and well-being, and especially values as we approach the end of life. And one of the great things that I see in my clients is how resilient older adults are. Older adults have a wealth of lifetime experience, which helps them adjust to changes. But sometimes it's just kind of keying into that so we can be more flexible, and know what our options are. So, just some things to consider as we get started here. 88% of us say that we want to age in place. I remember when my dad was still living, I mentioned something about, well, don't you want to downsize, Dad? And he laughed and he said, why would I want to live next to somebody else right above me and right below me? He really liked his space. So there was no way my siblings and I were going to convince he and my mom to move. And I'm happy to say that they're still aging in place. But very much like the statistics say, their home, like 45% of other individuals, doesn't and didn't really have the features that it needs. Think about in this area how many townhomes we have. You walk in and you immediately have to go upstairs, or in order to go to your bedroom, you have to go upstairs. And sometimes, or even in my house right now, it's only a powder room on the main floor when you finally get up there. 67% say that they do have someone who can help them with personal care if it's needed. Many of that 67% say that the individual is living with them. So oftentimes that might be a spouse or a partner. But what happens if that care partner passes away? What happens if they move out? What's going to happen at that point? 1 in 4 older adults fall every year, and a fall is the biggest risk factor for older adults. It causes the most amount of fatal and non-fatal injuries, really impacts the mobility of older adults. I was just at the doctor's office with one of my clients, and the doctor said, yes, you should definitely be using that walker all the time just to make sure that you won't fall. She's also getting PT to make sure that her balance and her strength remains strong. So it's repeated wherever we go. Hearing and vision changes. We don't really think about our hearing and vision until it starts to diminish. 6% of people indicate that they have a hearing issue, and 7% indicate that they have an issue with vision. And think about how safe you feel when you can't hear or see what's happening around you. As we get older, our vision kind of comes in, and of course, we know that when we can't hear, we miss out on things. I think we've all been in that situation where we don't quite hear what somebody says, but we fake it. And then, 3 days later, we realize that we said yes to something that we didn't even realize we were saying yes to because we didn't hear them very well. So it really can impact what's going on in your life. So, one of the questions I get frequently is why and when do older adults and their families seek help? It tends to be during a crisis. I know I just mentioned that we like our clients to reach out to us early when we can plan ahead. Um, when we can take a look and give them an idea through something like our roadmap of what might be coming down the pike, and what resources are out there so that when they need it, they can take a look at it and consult it. But the reality is that the majority of our clients do come to us after a crisis, whether this is a hospitalization or a change in somebody's function. It could be a new diagnosis. So perhaps a cognitive diagnosis has come, perhaps something else like Parkinson's or ALS. Um, Something that was unexpected, or maybe it was just a chronic illness that has really changed. Some of some of our chronic illnesses change as we get older, depending upon what's happening. One of the things that we have to look at, um, and I'll mention, I'll go into a little bit later, is when you're on medications and you gain weight or you lose weight, it's always a good idea to take a look at those medications. One of the things that we find with the clients we work with is they're on a ton of medications that have been prescribed by different providers who may not be talking with one another and maybe checking off on the box. Okay, yes, I see you're on this. I see you're on this. But are they really understanding why? So that's why it's always good to have a geriatrician who really looks over the entire health spectrum of an older adult to say, okay, well, maybe we need to titrate this. Maybe we can come off of this. Okay, you don't like how this medication is making you feel. Let's try this one. So that's another thing that we see. Sometimes it's when a child comes home for a holiday and they realize that things have changed. It can sometimes be difficult to pinpoint a change when you're seeing it every day. But then when you come out of town, you come in from out of town and you realize this person is functioning at a completely different situation. And we really need to get some help in here. And oftentimes what I find is children and their families want to do what they can. They want to give of their time. Not all of them. Not all of them can. And that's what we really see a lot, is that people are in that sandwich generation that we've heard about, where they're taking care of young children. Maybe they're even sending they've got high school kids that they're trying to figure out how are they going to get into college, who's going to pay for that. And then on the other side, they have a parent who is trying to age in place, but they're having these crises happen. Sometimes it's neighbors who who notice that something's happening with the older adult who lives beside them. And they want to know, how do we help this person? What services are out there? Sometimes it's following the death of a care partner, a spouse, or a caregiver. Unfortunately, one of the things that we see quite a bit is that a care partner may pass away before the individual who needs help, or who thought they needed help. Again, even in my own family, my father has now passed away. And yet he did everything for my mom. She doesn't need any help, but he set her up with long-term care insurance. He did this, he did that. Guess who needed it first? Not her, him. So you never know what's going to happen. So who are aging life care managers? And first of all, I should stop and tell you that the Aging Life Care Association is an association that Seabury Care Management belongs to. It's an association of professional care managers. We are experts in aging well. Typically, we are social workers and nurses. And within Seabury Care Management, we are mostly licensed master's level social workers who have over 5 years of experience at least in aging and hospitals or rehabs, that type of thing. But some care management practices have a mixture of social workers and nurses, as well as gerontologists and speech language pathologists or occupational therapists. We were able to add onto our staff last year a gerontologist and a speech language pathologist. And it has really been nice to kind of have just somebody else to run something by. Um, they don't practice as a speech language pathologist with us. That's not what we're licensed to do or provide, but they still look at things through that lens if, if we need that, which has been nice because she's been able to kind of point us in a different direction. We do, on occasion, when clients call, we take a look at what is happening with the client, what's involved. And there may be certain cases where we say, you know what, you may want to call this agency because they're all nurses. Or this is why we think a social worker would work best with you. We all deal with these complex medical and healthcare issues. But at times there may be a reason why you'd want to look at somebody with different types of certifications. So, what are some key components in aging life care management? We just had our advisory council and board breakfast this morning for Seabury, and it was really nice to hear one of our clients, our former client, or actually client, excuse me, her daughter came to speak, and the very first thing she said off the top was about how it was about the relationship between the care manager and their mother. Um, and this is something I see over and over again. I, as a care manager, will sometimes say the exact same thing that a son or daughter said yesterday, but because I'm a professional and I have this experience behind me, sometimes it's taken differently. So that's definitely one reason why it's about the relationship. And what I always tell whoever is paying for the service, whether it's the client themselves, so the older adult, whether it's a family member, whether it's a guardian, our client is the older adult. Our job is to get to know who they are, what their issues are. That's through the comprehensive assessment. What resources and services they already have into place. Understand kind of where those gaps are. Understand what are the resources out there, and then put them together. We do that to develop what's called a care plan. So understanding kind of, well, what are the things that we're going to need to overcome? Is there a financial barrier to this? Is there, for example, if somebody has wound care, is that going to be something that the community they live in can take care of? Or are we going to need to have a nurse involved in there? So those types of barriers and things. Our job is not to make decisions on behalf of our clients. It is to make recommendations. And then we take those recommendations and we run with it. We get those things put into place that are needed. Once that crisis has kind of been settled down, then we may drop down to a monitoring service where we'll visit clients, about once a month to continue working on some of these other goals that are out there. Also, just the daily well-being and problem solving that comes up. Even when we have clients who are living in a nursing home or an assisted living, it's always nice to be able to work with the professionals in that place just to make sure that our client is getting what they need. Sometimes the client may not even realize what services are there. So that's where we can help connect people. Unlike case managers, our role is really to connect services across the continuum. So for most of us who are working as care managers, we started out someplace else. I worked in home care, but others on our teams, again, worked in hospitals and rehab and things like that. And when you're in these other positions as a case manager, you really have to stay within your box. When you work with the hospital case manager, God love them, they have so much going on, um, but their role really ends when you walk out that door. Maybe there's another call or two that they can do, but they really can't follow you back or follow an older adult back into the community. By the same token, people, individuals who might be out in the community through government services providing some support services, they usually can't follow you into the hospitals or rehabs. So for us in care management, it is about being with an individual when they're in their own home, helping to manage those services, help or monitor the services that are coming in, making sure that everything is in place. Um, then if something happens and they have to go to the hospital, well, we work in tandem with the case manager that's in there. We don't want to duplicate services, but we also want to make sure that people just aren't picking from a list and saying, well, this place has room. Okay, well, let's advocate for the person. So that's our job, is to advocate for the person, make some recommendations that maybe they didn't know existed. And then if they have to go to rehab, following them back to rehab. If they need a respite stay at an assisted living, or maybe it's time for a change, we can help them with that, figure out what's the best place. It might be partnering with the caregiver to provide them education, to provide them with options, just giving them some coaching. So, one of the things that I like to really bring to people's attention is the ALCA's 8 knowledge areas, because I think this summarizes pretty quickly about, what are the areas of knowledge that you're talking about? You're saying that you're an expert in aging, but what does that mean? And these are the 8 topics that we tend to cover, or eight areas where some sort of a response is typically needed, or we need some information. Again, like I said, the first thing that happens oftentimes is that people come to us in a crisis. So it's addressing that and intervening. It may be getting those services in place. It may be just helping the decision makers, if the client can no longer make their own decisions, kind of what are the options? And again, that relationship, it's starting to build that rapport with the client so that we can also understand what their wants are, even if they can no longer speak for themselves. I really believe that even somebody who has dementia can give a little bit of input into some of these decisions. Now, can I ask them, well, do you want to live here or do you want to live here? No. But I can kind of get an idea of, okay, well, this is the type of place that would have them feel at home. This would really be a home for them. So just even having a little bit of input in it. The main thing that people know about us during crisis intervention is that we're boots on the ground. So if we have a family member who's involved, but they aren't in state, we might be the first person that's there. Or maybe they work a full-time job and they can't get there right away. So we might be the first person on the scene. And this is one of the things that you want to ask is, what does it look like when you have an after hours issue? For Seabury Care Management, we tend to work 9 to 5 and then triage Monday through Friday, and then triage what happens after hours. On the weekends, we have an on-call system that rotates around between our different care managers. So for example, I was just on call a couple of weekends ago. The next thing that we really look at is health and disability. So once everything is kind of calmed down, and oftentimes the first question we get from people who are moving into the area to be with family is, where do we find the providers that we need? If I have a new diagnosis of a cognitive impairment, how do I find out exactly what kind of cognitive issues this is, and how is that going to progress? What does that mean for me? And I'll tell you a little secret. nobody ages in the same way. I already said that. But even if I have two people with the exact same diagnoses, how that plays out with each of them is going to be completely different. However, there are certain things that we can help guide people through. We can be there to help kind of adjust the plan as things come up and as changes happen. So it's not only about finding the providers, but also understanding the insurance that's out there. For example, right now it's open enrollment season for Medicare. So this is when people should be looking at their Medicare gap programs, their prescription drug plans. That might be something that we help them with, or perhaps we refer them on to something like SHIP, your state health insurance providers, to talk through it. And it can be painful. Again, I'm using a lot of family examples today, which I do a lot, but I often intersperse it. But it just struck me because I took Monday and Tuesday off to go visit my mom. And she literally spent about 3 hours of her time with us on the phone trying to get that taken care of. And she has a nice plan through my father's former employer, but she still had to wait on hold several times and call, actually 3 days. She wasn't done by the time I left because they kept dropping her. This is just the reality of what it is. It's also about navigating the different abilities, so durable medical equipment. Who provides that walker? Who provides that wheelchair and how often? What about transportation? Transportation can really be that deciding factor between whether somebody gets to their healthcare provider, or not in the health and disability realm, but gets out there for socialization. So all of these are pieces that a care manager is going to be looking at, trying to understand what you have access to and what your benefits are. Financial. This is obviously a hard topic. People are very private about their financials, and I don't want to know everything. But what I do want to know is a general idea of what the financial situation looks like. That way, I can match it up with the price points that are out there and say, well, this would be a really good resource, but this is the cost of it, and this is who pays for it. So it's helping them weigh the pros and cons of the different services that are out there. As I said at the beginning, we are blessed to live in the DMV here. Almost anything that you can imagine is out there in this area. However, most of it is not paid for by insurance. And in fact, most of older adult care is not paid for by insurance. Insurance is really there for the health care unless you have something like long-term care insurance. And even with long-term care insurance, it's a good idea to check on your plan. I was shocked the other day. I was going through a long-term care insurance of one of my clients, and I was helping her just kind of call them and find out, when does this take effect? Is it something that takes effect? You know, you always have a 90-day waiting period, but could she start that now? And if she didn't need it anymore, is that still included in her 90 days, or does her 90 days start over? And as it turned out, her policy will cover a certain amount of home care, and it will cover nursing home care, but it won't cover assisted living care, and it won't cover the care that you get in an assisted living, which completely shocked me, and I think shocked her as well, because she is living in a CCRC. So I was honest with her and said, you know, we're going to make something work around you in your independent living apartment because you have something that will pay for it. But if you move to assisted living, it won't pay for it. So understanding kind of what is the lower cost alternatives, what might be the best suggestion. And again, we're making recommendations. We're not making decisions. That is for the client and their family. And then we just help move it forward. And we do frequently refer to financial planners if somebody doesn't have one, or a daily money manager, which can really help with the day-to-day budgeting, etc. Again, knowing where the experts are and then getting them into place. Legally, checking that all the documents are in place, powers of attorney, for both healthcare and finances. And there are so many resources out there that you can just go online, but it is really important to check with an elder law attorney because certain places, for example, the District of Columbia, has certain things that need to be in a power of attorney. Otherwise, they don't work. Um, so we also help people kind of weigh the pros and cons of who to choose for your power of attorney if you don't have one. If you don't have family and you don't have somebody that can, or you don't have children, or you don't have family that you feel can be a power of attorney, then what are the other options out there? And then we do, like I said, work with guardians. Fortunately, we have not had too many cases that we've had to recommend for guardianship. Um, but sometimes it does happen. And part of our role with guardianship is really to continue to advocate for the client when they can no longer make their own decisions. Housing is a big issue. Again, most people want to stay in their own place, but sometimes that's not best for people, or maybe it's just not possible any longer. I have often found that with my clients, one of the deciding factors is if they have to make their dining room into their bedroom with a little commode in it. At that point in time, people start making decisions. They don't want to stay there any longer. Some do, some don't have any choice. So, what are the options there if you don't have the choice? But just the knowledge of, what other housing is out there as far as senior care goes. You have the CCRCs that have the entire package. You have the independent, standalone independent buildings, assisted living and memory care, and nursing care. I'm happy to tell you that when I started this job, and when I started being a care manager back in 2009, almost every person, part of my job was to answer the information and assistance line. Um, and oftentimes somebody would call and say, well, so and so needs a nursing home. And I would often have to say, well, what do you describe that to me? What does that look like? It turned out they would be describing an assisted living, which is a less restrictive environment. Nursing home care is 24/7 care. Um, and it tends to be a little bit more restrictive because people are in there with very complex medical situations. And again, knowing kind of what the price points are for the area that you're living in and what's going to pay for that. Family. Family is another um, situation. Um, as we get older and we mature and we become successful adults, we can't leave behind some of the baggage. Sometimes even with therapy. But I tell people, when you get put into that situation where you are taking care of someone who took care of you, or you're having to be taken care of by someone who you're supposed to be taking care of, that's a really hard situation. Everybody has to kind of navigate that and go through a grieving process in it. Really kind of consider the changes that this means. And again, it's being flexible. For family care partners, it's also about providing things like support groups, reporting in on what's happening just to reassure family members, especially if they don't live on this side of the United States, or maybe even not even in this country. We've certainly had clients who are living overseas, that their loved one is okay, that things are going all right. And again, just providing that guidance on decision making. What are the next steps? And maybe even pulling in supports that people didn't think of. What I often find with my clients is they don't want to be a burden on their family, but I also hear from the family that they want help. They would rather have money spent on their parent or their family member as opposed to it being saved for them. So again, it's kind of help figuring out, can we find a balance here? Can we invite people into this support system? Are there ways that we can help? I know I used to send my grandmother, I never lived near my grandparents. Um, but my grandmother, who was actually born the same year and the same birth month as Seabury, um, I used to send her money just to get her hair done every month. And that was my way of contributing. Local resources is a big deal. Just understanding what is available. There are guidelines. Every single state and county in the nation is impacted by the Older Americans Act. So, understanding how that plays out in your area, what kind of respite care is there? Um, yes, there are probably long waits for certain benefits like these, but how do you even get on those wait lists? Are there ways around it, especially if you can't afford the services? Because certainly any of us could pay for respite care, but if we don't have that income, what are the other options? Knowing about what the veterans benefits are or that they even exist. Again, maybe looking at former places of employment. We have a program where we work with former foreign service providers. And in fact, they started a program, I say, in fact, but it was actually about 10 years ago, I think they started a program for the children of, so that the children could use this for their parents and just get an assessment, get an idea of what's out there, and maybe a little bit of care management services. But those are pockets. So knowing kind of where to ask for that. And the last thing here is advocacy. And again, that's an ongoing piece. Being able to advocate with physicians so that the older adult can live with independence and dignity, um, advocate with the insurance providers, hospitals and rehabs, community living. I'm again glad it's getting better, but it used to be, maybe it's that I'm getting older. Um, it used to be when I walked into a physician's office, the doctor immediately assumed that they needed to talk with me and not the older adult. So it's little things like that, gently guiding them back to the older adult, but also helping if my client hasn't mentioned something that she and I or he and I talked about that they wanted to mention to the physicians. It's making sure that they're getting the care that they need, that the people who are their decision makers, if something has happened and they can't make their decision, are being informed. For example, right now we have somebody who's in the emergency room and we're connecting them with the power of attorney who's not in this area. So it is really about advocating that they get what they need. We've talked about most of these, so I'll just run through them quickly as our time is running out here. But it's really a client-centered approach. It's really a continuity of care. And one of the things that I did not mention, but with Seabury Care Management, we can also follow our clients across state lines. Again, we're in a tri-state sort of area here. So although we have a client, say, who lives in DC, they may end up needing rehab care in Maryland. So we follow them over to Maryland. And then maybe their child lives in Virginia, so they end up moving over to Virginia. Well, we're going to follow them over there as well. Again, we're not an emergency service. Obviously, people should call 911 if there's an issue. But the care manager is there to get out there as soon as possible. It might be the next morning if it happens at 2 o'clock in the morning, but we're going to pick up that message and we're going to get out there. Oftentimes, a care manager can really save a client money just by avoiding hospitalizations or service duplications, maybe an improper placement. One of the things that I see quite frequently, and we also put a high priority on our clients' safety. But I also know that sometimes when people are discharged, it is about just being really careful. So, how long does that 24-hour care need to stay in place? And that's one of the things that we're in constant communication about, because 24-hour care can be quite expensive when you're talking about $36 an hour in this area. Again, we follow both the ALCA standards of practice and ethics, and because we're also MSWs, we follow our National Association of Social Workers guidelines and values. It can decrease the care partner's burnout. That was one of the things that our client's daughter spoke about this morning, was how, she was trying to launch her kids, but by the same token, she felt all this pressure on her of not knowing who to call, not knowing where to look. And that was something that the care manager was able to kind of provide to her, was just some information, maybe even doing. And in fact, we did a lot of footwork for her. It can be a time saver. Again, just knowing the education of what's coming next, what are the care options out there, navigating those systems, and then really a partnership with everybody that is surrounding you. Some of the things to think about are, what are the values? Where's their service location? I talked about our service location is throughout the DMV, all of Montgomery County, Prince George's County, DC, and then into Northern Virginia. Do they have on-call and emergency services? What are the expectations and what are the communication methods? We also have our life enrichment services, which is really to address those feelings of loneliness and isolation. It could be going on outings or out to lunch. It could also just be at home. We've had plenty of people who have learned how to play a new card game. We also had an individual who ended up doing one of those kind of manicures with her client, and they had the best time. And the children called and said, "This is wonderful. Thank you." Okay. And just, you have to understand what the fee structure is. We charge 185 an hour. Our life enrichment is 75, but we do try to keep an equity fund for individuals who qualify that can reduce that cost. About 20% of our hours are subsidized through our equity fund. All right. So I put my information here, and we can certainly get this out to you, but I wanted to go to the Q&A and see if there are any questions.